Health Minister Dr. Zweli Mkhize says government is expediting the delivery of the coronavirus vaccine to South Africa. He says structures have been set up to expedite the rollout of the vaccine. Mkhize and some members of his task team gave details of the vaccine rollout program for the country. With rising infections and deaths, there are calls for government to act with speed in procuring the vaccine. Frontline workers, essential services workers, and the most vulnerable will receive the vaccine first. Now, for reaction to this, we are now joined via Zoom by the president of the Young Nurses Indaba Trade Union, Lerato Mthunzi. Good morning, Lerato, and welcome to the agenda. Happy New Year. Nice to see you in good spirits. But first of all, let's start off here. Reaction to the minister's address last night.
I honestly believe that the vaccine is long overdue, is what we've called for, and we do believe immunity through vaccine is indeed the way to go. However, our concern remains that which workforce is going to be able to expedite this big task. The minister has rightfully said they've put up structures in place, but we are still expecting the same frontliners who are currently burned out, who are currently not coping with the second wave, to be the very people again that are going to expedite. So what we are calling for really is more hands on deck. We are asking for employment of nurses. As I'm speaking to you, Adrian, we've got one of the biggest hospitals in Johannesburg, Lerato Mthunzi, informing a qualified registered nurse that was just finished their concept that they must vacate. They do not have posts for them. And we are talking about this vaccine that is so big that is coming through. And at the same time, we are talking about people that have died in the line of duty, which up to today, they've not been replaced. So really, we are crying in terms of human resources, in terms of the resources. We want to see them palpable in the hands. The PPE remains an issue. So yes, we want the vaccine, but can the capacity of healthcare workers be increased?
Lerato, is this a general problem? Because I think I read in the papers yesterday as well that there were some doctors who were interning who have now completed that period, and they've also been told that they should be vacating those posts. So is this something similar to what's happening with the nurses?
Absolutely. This is a problem of year after year, from the office of the Minister of Health, Dr. Zweli Mkhize, who has not fixed the issue of placement of qualified healthcare professionals. Now more than ever, we are in dire need of having doctors and nurses employed in our system. And here we are, thousands of them are going to be released to go and do what when we are burning in the line of duty. So yes, this is a continuous problem that continues not to be resolved by the Department of Health at the national level as well at the provincial levels.
From the information that you have in relation to Lerato Mthunzi, how many nurses will be affected?
About 33 of them, as I'm talking to you, I was engaging with them this morning. They're sitting in meetings that they're saying the Department of Health in Gauteng has not communicated. Sterfontein is affected. In fact, all the hospitals are affected. It's just some of them are saying, let's wait, let's give it a week. Maybe the department will then respond. And this sluggishness of the department and putting people's jobs and not giving healthcare providers job security. And I'm talking out of those 33 in CMJA, I've spoken to 5 who are COVID positive. They're currently on quarantine. Imagine just getting a call at home and you're told, do not come on duty, even though you're you've risked your life, you've risked the lives of your families, and you are just thanked with a slap on your face. It cannot just be correct.
What's the explanation then from the department around this particular decision that has been taken? And now just focusing on these 33 nurses at Lerato Mthunzi. And I'm asking this question also on the basis that we expect a huge resurgence now as people or holiday makers are making their way back to the province.
For me, it just talks to poor planning. It just talks to poor maladministration by the Gauteng Department of Health and the National Department at large. But there is no explanation. People are still on holiday. People are not saying anything. So people are just sitting, gathering in boardrooms, waiting to be told if they do even have jobs, which cannot be condoned.
Mm-hmm. And it's not like the services are not needed, right?
Like I'm saying, we are in dire need of each and every healthcare professional. There shouldn't be a nurse or a doctor that is unemployed during this time. The second wave, like you said, I mean, we are looking at around 29,000 of fatalities. I mean, at this present moment, and every day per day, we're getting more than 18,000 infections. We need every nurse, every doctor to be helping us with this load. Otherwise, we are going to have a healthcare system that is not going to work. And another concern really is to say, yes, we've called for the rollout of the vaccine, but we need to be very strategic. We can't say all frontliners, all essential workers, all vulnerable people must be immediately vaccinated. We need to give it some time. It needs to be well staggered. It needs to be well planned, just in case some react to the vaccine. We cannot just, take a huge risk. So it must be a calculated risk that the department is going to take. It cannot be a blanket approach.
What do you mean by that?
I mean, when you go through the strategy of the minister, they say they're going to prioritize healthcare workers and frontline workers. Yeah. So what we are calling is, let there be a plan of saying, let's look into when we're rolling out, let's make sure that each and every group is properly monitored. And if there are reactions, we are able to say it's not all healthcare workers, not all frontliners that will have a similar reaction to the vaccine, because we don't know, as it stands right now, what will be their medical reaction on it.
So wait. Does this mean, Lerato, that you as nurses are not sure, and this is now speaking of nurses as being part of the healthcare workers, are not sure about the side effects that this vaccine, whichever vaccine is being procured, will have on you, if any?
Look, the details about which vaccine and as to from where this vaccine is from the department has really been sketchy up to this far. I can tell you we've not trained any nurses so far to teach them about the vaccine. You'd appreciate that before we give any member of the community, at least we need to understand the pharmacodynamics, the pharmacokinetics of this drug, what the drug will do to the body and how the body will react to this drug. At this present moment, I can safely tell you that information to the very people that will be vaccinating the family is not there. It's the same issue that we cried when COVID-19 came upon us, and it was adamant that it's here to stay. Still, we cried about training of healthcare workers and really proper equipping and upskilling the healthcare professionals that are expected to actually be the ones who implemented these rollouts.
Whoa, Lerato, that's a bit concerning. I thought that the training would be happening in the background. And speaking about the issue that you raise around a staggered approach, is that if you look at what's happening in Argentina, at least, they didn't go for the whole 10 million and try to secure 10 million instead. Or what is it? We're saying that we want 10%, about 6 million. What they've done is that they've procured about, I think, 600,000 of the vaccines that they are using, and focusing on healthcare workers. Do you think that should be the approach? Because if that is the approach, that means that we have more vaccines, or we have a few number of vaccines available immediately that we can then give to the health workers and probably deal with some of the concerns that you have raised.
Absolutely. I think, as a nation that normally jumps to curative and treatment, we should this time around be very cautious when we apply this. We have to not neglect the ailing healthcare system. We cannot ignore the issues of human resources and making sure we've got adequate, all the supplies that the nurses and the doctors will need to be able to do that. We cannot just run and say, let's just vaccinate. We still need to make sure that preventative measures are adhered to, and we really try this time around with all the money that the minister is talking about. We really improve the infrastructure of our hospitals. We really become more ready, more than ever. I can tell you right now, with the second wave, we are not ready. We are not ready with the first wave. All monies were squandered, were looted. So we are really working with the healthcare system of people that really do not care about the health of South Africans.
Okay, let's then quickly touch on something else that I saw in the papers yesterday as well. I think it was a report out of Durban that some nurses were forced to work even though they are COVID-19 positive because of the pressures that you have explained now in terms of the staff number.
Look, It's not just Durban, it's across the country where even one has tested positive. They'll say, because you are not having signs and symptoms, do not quarantine, continue working. And if you refuse, your work is on the line, unions must be involved and so forth. So it's been really the approach. And even the facilities that are in where there is infections, they would not even fog those places. That still remains a problem. We are not really practicing and what we are preaching to the community, where we are saying sanitize. I mean, it's worrying issues where you find that the very public hospitals, some of them don't have a mere soap and paper towels to date as I'm speaking to you. So really, these are some of the worrying issues that healthcare workers find themselves having to be, put under so much pressure to work, and if not, their jobs are threatened.
And Lerato, I have to say that I sympathize with the nurses, because this is not the first time you and I have had this conversation about the pressures that are being faced in the healthcare sector. However, though, doesn't the nurse also have a responsibility to protect the patients that they would be nursing if they are COVID-19 positive themselves?
The role of the nurse, without a doubt, is advocacy. That's why those who are woke enough will come forward and report to their trade unions, and we are able to intervene accordingly, because the guidelines for COVID and following regulation is not for the public only. Employers, whether private or government, must be held accountable, and that's exactly what trade unions have been doing, particularly Young Nurses Indaba have been doing, to make sure that where these regulations are undermined, we hold, and heads indeed do have to roll when people do not ensure that these things happen.
Okay, so what's the next step then for you as the nurses in Indaba?
As we start the year, obviously we want to emphasize on caring of the carer. We want to emphasize that the Department of Health cannot put too much work and keep on piling. We are going to make as much noise as possible to say we need human resources. We request that if we are talking about resources, let's not go to the public and promise them vaccine and the clinics and the hospitals are filled, and you know for a fact that it won't be there. So can we have the political will that is needed on the ground? Can we have the resources that we need? And most important, can we employ all the healthcare professionals that are currently being threatened with unemployment?
Remote centers that will also be set up across the country, including in rural areas. Do you know about that plan?
Look, most of the plans that the department puts, they're always half-cooked. We've had tents in our facilities that served little to no purposes. We've had mortuaries, mobile mortuaries that served little to no purposes. We've had this mass campaigns of testing people, which bad, really honest, and then we had to renege from them. So plans that are put, to be honest, can they not be selfish plans that are to benefit a few so that they can benefit some kickbacks from procurers and so forth? But it can be genuine issues. So really, as they're saying, they are engaging stakeholders. I think it's important that labor is also involved, and we are able to be the watchdog on these processes. Because otherwise they will say they are putting up the satellite tents only for them to actually loot, and the community at large would not even benefit.
Oh, Lerato, how sad is it that constantly when we have a conversation about the health sector, that the corruption element always creeps in, even now with the vaccine?
It has become the DNA of the department, and I think it's something that is not addressed to the core. It's something that is just purely swept under the carpet, and those who commit this looting and corruption gets away with impunity, and they know there's no repercussions for it. So why stop if there is nothing that's going to be done on them? It's such a pity thing that health is about life and death, and when those who steal really from these hospitals and from the nursing care and the care that must be given by doctors, they're actually stealing from themselves, and they're stealing lives of our community members. It really is a sad situation in our country.
Thank you so much, Lerato. I hope that things would be a bit better now after that briefing that took place from the minister and his team, and there will be better communication between the health workers as well as the department. That is the president of the Young Nurses Indaba Trade Union, Lerato Mthunzi, reacting to the health minister's COVID-19 rollout strategy.